All right. Hello, everyone. Welcome. Thank you so much for joining us today for our webinar, Youth Mental Health in Hawaii, Stats, Challenges, and Solutions. My name is Amanda Martinez, and I am the Training Program Manager for Mental Health America of Hawaii. And for today, what we'll be covering is a little brief introduction on who we are as an organization. We're going to be going over some statistics that are relevant for our youth here in Hawaii. We're going to be talking through some of the different challenges that are present as far as access and services and COVID-19 related challenges as well. And then we're going to spend some time really talking through some solutions, right? What are those things that we can do to help support the mental health and mental wellness for our youth here in Hawaii? So that's kind of a brief overview of what we'll be covering today. Before I totally jump into the presentation, a couple logistics for everyone who's joining us. This is a webinar format, so all of your cameras as well as microphones are automatically turned off, so don't worry too much about accidentally turning anything on. It should not happen. I do encourage interaction. You have a few options available to you, so if any questions come up during the presentation, we will be leaving some time at the end to be able to address any questions that arise, but you do have a Q&A feature on your Zoom toolbar. Feel free to drop any questions you might have in there. You'll also have a chat box feature, right? So any comments or maybe some questions as well, you can go ahead and drop into that chat box as well. Right, so who we are as an organization, Mental Health America of Hawaii has actually been in the state for over 75 years. It was established in 1942. So we do like to consider ourselves a statewide organization with our main office on Oahu. We also have a branch on Maui, which is run by Miss Danielle Bergen, who's a really great resource. If you're looking for any kind of Maui County resources, absolutely contact her. But really what we aim to do is to promote wellness, mental health wellness through three different areas. So education, advocacy, and services. Right, so historically, Mental Health America of Hawaii has been the lead of or a member of various coalitions and task forces, really advocating for an increased access to mental health care, mental health services, and promoting overall mental wellness across the state. Okay, so here's a list of just some of the various coalitions and task forces we have been involved with in the past. Our second area where we try to accomplish our mission is education. So this is really where the bulk of my time is spent, is offering community trainings. We do several a month, so you're obviously signed up for this one, but if you're looking for any kind of future opportunities, sign up for our newsletter, check our website. We're always posting the schedule and availability for future trainings, but this is just a list of all the trainings that we have been offering and we do currently offer. So we do community trainings, but if you're interested in bringing any of these trainings to your organization or workplace or your school, please absolutely reach out and contact me. We're always happy to set up a schedule, look at availability, and offer these trainings to all of you in a virtual format, so keeping things safe. Right, so the third area that we really work in has to do with services. So as an organization, we don't provide direct services per se, but rather what we aim to do is really try to connect people to those services and to those resources. So we have a funding helpline. Feel free to call our office if anyone is looking for a specific service or is just looking for more information or different resources. Usually someone is in the office available to take a call Monday through Friday, about 9 a.m. to 4:30. We also have a Finding Help phone list, which is captured on the right-hand side of this slide here. You can find the PDF version on our website as well, which is in that little blue bar there. This has a really great list of social services, pretty much any topic related to mental health. And the really cool thing about it is that it's also separated by island. So you're able to identify specific resources and organizations that are in your area. So when it comes to services, again, we don't provide direct services, but we're always happy to help answer any questions or point people in the right direction. So I do want to do a quick little poll because I know it's awkward sometimes in this virtual format, that I want to make this as interactive as I can for you. So I'm going to pull up a poll. It should just automatically come up on your screens here, and it is totally anonymous, so don't worry about outing yourself in any way, but just as a little icebreaker here for us. When passing by a reflective surface, I use it to see if anyone is following me, I check myself out because doesn't everyone, or I use it to contemplate the deeper meaning of life. So I'll give everyone maybe about a minute to answer this poll here. I already see the votes coming in. Thank you for those of you who are participating. If you don't see the poll on your screen, feel free to drop your answers in the chat box as well. However you want to interact, I encourage. All right, it looks like a majority of people have cast their votes. So let's see what we have for our results. All right, so we got 22% say they use it to see if anyone is following me. We got majority of 67% say I check myself out because doesn't everyone. And we got 11% say they use it to contemplate the deeper meaning of life. That's awesome. Thank you so much for participating in that, in this poll. So, you know, the purpose of this wasn't not only to be a little icebreaker for us, to make things a little interactive for this webinar. There's certainly no right or wrong answers when it comes to this question. It really depends on the person and probably the situation as well. But the point that I'm trying to make with this poll, as well as with this training and really any other training or presentation that we offer at Mental Health America of Hawaii, is to not, the goal really isn't to turn any of us into mental health professionals by any means, right? But hopefully with some more information, some more tips, some awareness about resources that are available, we're adding tools to our toolbox, and thus we are increasing our noticing skills a little bit more. And that's really what it comes down to, right? That we're increasing our noticing skills, that we know what we want to be on the lookout for when someone may be struggling with their mental health. And we also have some knowledge about where to help them find that resource or to find that help and extra support. Right. So thank you for participating in that poll. For myself, I would probably use it to see if anyone is following me because I'm a huge true crime fan and I just am always kind of on the lookout of my surroundings. So I would want to know if anyone's in my immediate personal space, especially now that we're supposed to be physically distancing. But thank you again for sharing your answers. It's always fun for me to see. All right, so let's take a look at some statistics. So most of the stats that we'll be seeing over the next couple of slides come from a variety of different resources. One of them is the Mental Health America. As a national organization, they give out a State of Mental Health in America report pretty much every year. So I'll have a couple statistics coming from that report, and then the rest will be coming from the Department of Health here in Hawaii, as well as the Youth Risk Behavior Survey, which is a survey that goes out to schools every couple of years, so anonymously self-reported data from youth themselves. Now, I do want to make a little caveat when we go over these statistics, is that some of them do represent pre-COVID data. There's continuously research being done about the impact that the pandemic has had on the mental health of our youth, but I think it's safe to say that it has absolutely had an impact on all of our mental health, right? For youth, for adults, for different socioeconomic groups, different geographic locations as well. So we're just kind of taking a pulse a little bit, right? Taking a look at what it was like before the pandemic and what we have been seeing come out. But there's continuous data that's being made available as far as research goes. Okay. So this first slide comes from that State of Mental Health in America report from the national organization. So what they found was that almost 13% of youth in Hawaii experienced at least one major depressive episode in the past year during the time where that survey was taken. And of that almost 13%, 56% did not receive any mental health services, right? So didn't receive any help. So that's at least half, right? And that's pretty reflective, I think, of not only help-seeking behaviors that we see for the public, but also kind of all the reflective of the barriers that are present, right? When we are trying to reach out for help, whether that's awareness, whether that's access to services. We'll go through what those different challenges are later on in the presentation. But let me ask you this, how long on average do you think it takes for someone to receive treatment or to receive help for a mental health problem? Right? And you can go ahead and put your guesses in the chat box. So from the time point when someone starts first showing signs and symptoms of a mental health problem to the time point where they actually receive help for that, how long on average do you think that takes? And this could be on a national level, not just Hawaii. Awesome. I see a couple answers, guesses coming in. If you send a message to all panelists, only I can see that. If you send it to all panelists and attendees, then everyone else on the webinar can see it as well. So there are answers coming in, I promise you. I'm not just saying that to say it. All right, we got 1 year, a month, 6 months, 3 months, couple weeks, a very long time, over a year. All right, these are great guesses. Thank you for dropping those in the chat. Right, so actually on a national level, on average, it takes someone about 10 years, right, to receive help or treatment for a mental health problem from the time where they first start experiencing signs and symptoms. The average on a national level is 10 years, right? So that statistic was pretty shocking to me when I first started, because 10 years is a really long time, right? And I think this is especially concerning when we think about our youth, who are already going through a lot of changes, right? A lot of transitions. They're still developing physically, emotionally, socially, going through a lot of life changes. Again, a lot of transitions that are happening. And when a mental health problem is not caught early, right? Or if there is no kind of early intervention or early help that's made available, if it goes untreated, it's more likely to persist into adulthood. Right? And it can also occur with other mental health disorders as well, or even substance use disorders. So I think it's just important for us that we highlight these types of statistics as well, because it's so important that we raise awareness, that we educate ourselves, that we educate other people, and we educate our youth on what to look out for, right? And raise awareness that there's a lot of help and support that's still being made available, even in these virtual formats as well. So just know that those resources are out there and available. Please reach out to us at Mental Health America of Hawaii if you need help being pointed in the right direction. Here is another statistic for us, also coming from the national organization. So what Mental Health America does is they offer free online screening tools, several different tests that people are able to hop on and take online for free. This was a graph resulting from their screening results for the month of June, right, of 2020. So what they found was that the risk for emotional, attentional, or behavioral difficulties was very high, very present for youth, right? For young people who actually took that online screen and answered those questions. And I think what's really interesting that they found was they asked what the reasons were, right, behind the higher experiences of feelings of depression and anxiety. And it wasn't just COVID-19, right? It wasn't just the pandemic as the sole reason behind increased levels of depression and anxiety. Rather, that's suggestive of larger societal issues at play, right? So not just a worldwide pandemic, which is stressful in and of itself, but it's also the political climate of our country today, right? The recent events at the Capitol, the inauguration, the political divide that we see, the social unrest that we've been seeing across the country, right? In every single community. So there's also these kind of larger societal issues that are playing. And I wish we had more time to kind of dive into and totally unpack, but just know that there's not one sole reason behind these increased rates of depression and anxiety that we are seeing for our young people. This next graph comes from the Department of Health, right? So when it comes to suicidality specifically, here are the top causes for fatal injuries for our youth here in Hawaii, and really a bunch of different age groups for the years 2015 to 2019. So across the top, we have the different categories for age groups, and then down the left-hand side, we have the different rankings, right? So suicide is actually a leading cause of injury death for our youth here in Hawaii, but we also see it kind of higher up across the other age groups as well. Right? Overall, on a national level, it's the 10th leading cause of death. Across all age groups, it's the second overall leading cause of death for youth in the United States. Now, whenever I look at statistics like this, especially when it comes to suicide deaths or suicidality, I always try to look for little nuggets of hope. Like, where are the opportunities that we can step in and we can make a difference? Because it can be impactful, right? To see that suicide is so high up on these rankings, right? So if I can provide an example for you about prevention efforts, if we look at the yellow boxes, motor vehicle accidents, right? And we think about all of the prevention efforts that have been put into preventing car accidents, right? Making safer vehicles, requiring seatbelts, airbags, traffic laws, raising awareness surrounding drunk driving or distracted driving even. If we put these same kind of efforts into suicide prevention, I really think we would also see a difference, because we have seen a significant decrease in motor vehicle accident deaths across the decades because of these prevention efforts. So there is little nuggets of hope out there. There's opportunities to make a difference. There are a lot of prevention efforts that are happening currently here in the state. We'll go over a couple organizations who are doing a lot of really great work in that area. But again, we're just kind of providing a little snapshot for us and what it looks like here in Hawaii. Right, so the next couple slides reflect data from that youth risk behavior survey, right? So anonymously self-reported data directly from students. The most recent available we have is from the year 2019, so again, pre-pandemic. But when it comes to suicidality, they found about 1 out of 4 middle school students, 1 out of 6 high school students reported having suicidal thoughts. 1 out of 6 middle school students, 1 out of 7 high school students reported making a plan. 1 out of 8 middle school students and 1 out of 10 high school students reported making a previous attempt, right? So again, when we're seeing these numbers here, again, these are self-reported. I'm always looking for that opportunity for intervention and prevention efforts to really work. So what is encouraging for me to see, at least, is that these numbers are decreasing as we kind of move along this spectrum, right? As we get a little more serious when across that spectrum of suicidality, that not everyone who thinks about suicide, not everyone who makes a suicide plan, not even everyone who attempts suicide actually dies by suicide. So what that tells us, at least, is that, again, there's a lot of opportunities for that prevention to happen, right? For someone to step in and help, or for us to even reach out for help before it actually reaches that point. So whenever I see presentations like this, or we put on presentations like this, a lot of times people are really focusing and honing in on what are the risk factors, right? What are the things we need to be on the lookout for? What's that data that we need to be aware of? And what people don't always talk about alongside with that is the protective factors, right? What are the things that are already present, right, in our communities to help combat those risk factors? So I always like to include also a couple statistics on those protective factors. So again, these come from that youth risk behavior survey, so anonymously self-reported data from those students. Almost 84% of middle school students, almost 82% of high school students felt that they had an adult or a teacher that they could talk to in a home environment or a school environment about things that were just important to them, right? About things that matter to them. And youth are pretty resilient overall. And that resiliency, that sense of resiliency, really increases when there is support from adults and peers in that youth's life. So there was also a really great study that was done a number of years ago called the Kauai Longitudinal study. So Hawaii specific data again. And what they were looking for was those factors. What were those things that were in those youth life? They followed a group of youth over a couple decades, and they were trying to find what those protective factors were that increase their resiliency. And what they found was having one meaningful adult, one meaningful peer, and one meaningful activity greatly increased the resiliency of a group of youth. And I think it was like a 30-year study period. So one meaningful adult, one meaningful peer, and one meaningful activity increases that resiliency, which is ultimately what we want to be doing, right? We want to be increasing emotional strength and increasing that resiliency, because there's so much that's happening in the world today. And we need to be able to help support our youth, but also help our youth support themselves as well. And very similarly, we have almost 68% of middle school students, about 61% of high school students felt that they had one teacher or another adult in their school that they could talk to if they felt like they had a problem, someone they could turn to for that support. And I think that's also super important, right? That we're identifying who those adults are, who those meaningful adults are in our youth's life. It doesn't always have to be a parent or guardian, right? It could be auntie, uncle, another family member, a friend of the family. It could be a teacher, counselor, another adult figure in a school environment, even in a virtual setting, as long as our students and our youth feel like they have someone that they can turn to if they have a problem, or they have someone in their life who cares about them, who wants to hear about their days, who wants to check in with them. This is going to increase their resiliency. So if we can continue to foster these supports and foster these connections, then we can help to increase that resiliency of our youth. Right. So let's take a look at the different challenges, right, that are present, right? What are those barriers? So what are the things that we know or don't know when it comes to mental health problems? What are some of the missing pieces? And maybe what are some of the pieces that really no longer fit? So we obviously know that there is a need, right? We know that mental health problems are common, and they also actually develop during adolescence, right? A majority of them do. So about half of all mental disorders actually begin by the age of 14, and 3/4 begin by the age of 24, right? So we see mental health problems manifesting, start experiencing those signs and symptoms at younger ages, which again is why it's so important that we're having these conversations, that we're creating the space necessary to have these dialogues, even with our youth, right? Because we see that mental health problems are common for everyone, right? But also for our youth. Youth and young adults may experience symptoms a little differently than adults do, and that makes sense, right? Again, they're still kind of developing physically, emotionally, socially, so it makes sense that they might experience symptoms of mental health problems differently than we may as adults, right? Youth may not be well informed, and I think this might also be true for some adults as well. Some people, and I see that that kind of comment in the chat as well, is that most people may not even know what it is that they are experiencing, right? They may not realize that, what they are experiencing is not a part of a typical healthy adolescent development process, right? So again, important that we're increasing awareness, that we're having these conversations, and we're increasing our noticing skills as well. So one of the barriers has to do really with access, right? And this is kind of really in a general way, or a general format. But there's a lot of barriers when it comes to access. It could have to do with no insurance or even a limited insurance coverage, especially with the economic fallout as a result of the pandemic, right? A lot of people may have lost their jobs, and as a result, maybe have lost their insurance coverages as well. There's an overall shortfall in psychiatrists and a really undersized mental health workforce here in Hawaii, especially on our neighbor islands. We also see a disconnect between primary care systems and behavioral health systems. So historically, people have really thought about physical health and behavioral health or mental health as being two separate things when they're actually very much connected, right? And so our approaches when it comes to prevention efforts and intervention efforts, and when we're thinking about access to services, really need to be the same, right? We should have that same kind of approach for mental health problems as we do for physical health problems. I mean, when you see that someone has been injured, let's say they've broken a bone, immediately we recognize that, and we're trying to get them help as soon as we can, right? We're getting them to see a doctor, we're taking them to the emergency room so they can have an x-ray done, so they can have a cast put on, and so that recovery time afterwards is effective, right? And that's not always the same approach that we have when it comes to mental health problems. And that approach may look a little differently, but the intention there should be the same, right? That we should be recognizing when someone may be struggling as best as we are able to, and really connecting them with the help and services and resources that they need in that moment. It could have to do with finances as well, right? Also related to insurance coverage possibly, but even just trying to cover costs for copays, or if someone has to be in an inpatient hospital, right? Residential treatment. Maybe some providers don't take that specific insurance, or the coverage is limited and they don't have the finances to cover that surplus amounts, right? So again, a lot of barriers that really surround access to services, which on an advocacy level is important, that we are raising awareness even in that sense. right? So we can help to increase access to those services and kind of break down some of those barriers. So another challenge that we see associated with mental health really has to do with stigma. And in my opinion, I think this is one of the biggest barriers that we have seen when it comes to mental health problems and people's help-seeking behaviors and how we view mental health as a society. Some people may view it as a moral or character flaw, right? That something is just inherently wrong with that individual. There may be a little bit of denial happening as well, right? That's not me or anyone in my family, none of my friends. So it's not my immediate vicinity. So it's just kind of not on my radar. It's not really happening, right? It's not there. Some people may look at getting help or seeking help as a sign of weakness. And this one always kind of gets me a little bit because I think the exact opposite is true. Someone is able to recognize that they need a little extra help or support, or they're willing to be able to accept that help, right, from another person who cares about them. I think that's a huge sign of strength because that's not always the easiest thing to do. And then we also see a media portrayal of mental health, right, in our news, on social media, and movies, television, radio shows. That's not always a very positive light being shown on mental health. Right, so we're going to do kind of a little activity again in this virtual format. But what I want you to do is to utilize your chat box feature, and I want you to put in the chat all of those words, all of those phrases, all of those names that you have heard used to describe someone with a mental illness or a mental health problem. Right? It doesn't have to be your own personal opinion. It could be something that you've heard on a movie, television show, and read in a news article. It could be things that you just hear in the community. They trippin', yes. Cray cray, absolutely. Crazy, yes. Unstable. Right, thank you to those of you who are dropping that in the chat. All of these words: bothersome, medicated, right. Liability, hindrance, right. Dramatic, yes, the drama, right. Difficult, yes. And I'm saying yes just to affirm your answers, right? Not that I agree with all of these things that you're dropping in the chat box. Broken, attention seeking. Yes, I hear that one so often. Chronic, right? All of these words, right? And so when we're thinking about all of the words that you dropped or the phrases, unhelpable, right? They're just not, there's no hope, right? To be able to reach that individual or help them in any way. When we're thinking about these words and phrases that you dropped in the chat box and I said aloud, is there more of a positive kind of aspect to it or negative? And I think that's probably a pretty obvious question that I asked, but I already see in the chat that it's negative. Yeah, absolutely, right? That the words and phrases that we so often hear being said out in our community, that we hear in movies and television shows, on radio shows, that we read in news articles when we're talking about people who suffer from mental illnesses or mental health problems, is often negative connotations, right? It's not always being talked about in a positive way, right? So this contributes to the stigma that's still associated with mental health, right? I do want to say that I think one of the more positive aspects to come out of this pandemic, if we can say that there is one, is that there has been more light being shown on mental health, right? Because this is something that's impacting everyone, right? No matter how rich or poor you might be, no matter where you're living, just across the board, across different age groups, it's impacting every single one of us, right? And so I have been seeing more people being open, right, about their struggles with mental health. They're being honest about how everything that's happening in the world today has been impacting their mental health, right? So I do think that's a good thing to come out of all of this, and that really is going to help towards kind of lowering that stigma, and in turn, hopefully it helps encourage help-seeking behaviors from people, because when it comes to stigma, it really affects mental health in so many different ways. But what it has the especially harmful effect of is really silencing that discussion of mental health, right? That it's something that we sweep under the rug or keep behind closed doors or keep within the family, right? Causing people to not want to acknowledge that mental health problems are common, right? Maybe that's a barrier towards seeking help or seeking different resources. And I do want to say that culture, I saw it in the comment, thank you, who dropped that in there, bringing up cultures. Culture is one of those things that is constantly running in the back of our minds, right? Culture has a huge influence on everything that we do, how we view the world. And that's also true for mental health, right? How we view mental health problems, how we view help-seeking behaviors as well. So that's always something that we want to keep in the back of our mind. It's definitely a huge influence. Right. So when I do that activity in person, which is why I kind of have that little snapshot of post-it notes, is that I have everyone write down those words and phrases that we brainstormed onto little post-it notes. And I have a volunteer come up to the front of the room, or my co-trainer, and we stick those post-it notes all over on their arms, on their legs, right, on their body. And what the point of that kind of activity is that it's a visual representation of what that stigma is, right? That we're associating all of these negative words and negative phrases to a human being, right? And that's what they are first and foremost, is a human being. Just because they may be suffering from a mental illness or experiencing mental health problems, that's only one facet of their identity, right? There's so many other facets that are there and make them up as a person. Right? So we also see some pandemic specific related challenges as well for our youth, right? So there was a definite disruption of education, of schedules and routines that we saw. I mean, when the pandemic came to Hawaii last year in 2020, our students went on spring break and then they just kind of never went back to school, right? So it was like they didn't even realize, no one ever thought that this would be the last day that I got to see my classmates or my peers in that kind of setting. So there was a huge disruption in education, in schedules, routines, all of that just kind of went out the window, right? Very suddenly. And we've been working over almost the past year, right? Trying to reestablish those routines and those schedules and be able to educate and distance learn and still keep up social lives and create routines in really creative ways. Right? We also see missing of milestones, right? So graduations, birthdays, anniversaries, right? Maybe those students who were expecting to go off to college, right, this past fall, right, to move out of state, even to be able to experience that dorm life, their first year at college, maybe college graduations as well, and finding a career. We see a missing of milestones and even those transitions that happen during that developmental period absolutely being disrupted and interrupted. Physical distancing has also had a huge impact as well, right? And I use that term physical distancing because yes, we should be distancing ourselves from other people, right? To keep our family members, our friends, and the community at large safe, right? But it doesn't mean that we should be completely socially distancing or isolating ourselves in any way, right? So we see our youth being unable to physically hang out with their friends, right? You can't just go to the movies or go to the beach or hang out at the mall like we used to or they used to, right? Everyone is kind of stuck in the same household, all trying to work remotely and distance learn at the same time. So we're all wearing different hats, right? We also see inequalities that existed before the pandemic happened, but we see those inequalities becoming even more pronounced now, right? And some examples of that would be schools maybe are no longer able to be a source of regular meals, right? For some students, going to school and getting that lunch every day was a regular source of a meal. It was something that they relied on and those families relied on. Some students may not even have access to a laptop or to the internet or Wi-Fi to be able to participate in distance learning. So these are definitely inequalities that existed before the pandemic hit our communities, but that they are becoming more pronounced now because we are relying so heavily on technology to be able to keep these connections and to keep up some sense of distance learning as well. Right? And then of course we see that kind of uptick in mental health challenges across the board as a result of the pandemic. Yeah, I see that the comment in the chat box. Yes, absolutely. Thank you for that. It is heartbreaking to see students who, saw their friends graduate the year before, right? Those coming of age events. And when it comes to their turn, right, this is their moment that they just can't celebrate in the way that we used to before, right? Gathered together in large groups in that sense. So absolutely, it is definitely heartbreaking to see that. So let's talk about some solutions, right? Again, this is me always looking for those opportunities, to make a difference, or those little nuggets of hope, right? Where can we help? Where can we step in? How can we help? So one of the biggest questions that we often ask in public health, which is kind of what my background is in, is so what, right? Now that we've done all of this research, we've looked at all of the data, we looked at all the statistics, we've established that there's a need in our communities. So what are we going to do about it, or what can we do about it? So the kind of solutions that I'm presenting to you today are very general kind of starting points, right? Different areas that we can work on individually to be able to make a difference, right? To help support our youth. Okay, so this is actually the social ecological model. This is something that I saw a lot of in grad school, but our main focus here at Mental Health America of Hawaii is really a very much public health approach when it comes to prevention efforts. So the social ecological model, just like I'm not trying to turn you into a mental health professional, I'm not trying to turn you into public health professionals either. So let me summarize this model for you. Really, this is a theory that states for any prevention effort to work, for it to be effective, for it to be sustainable, that those efforts need to be happening on multiple levels, right? So what are we doing on an individual level when it comes to self-care, when it comes to learning coping skills to be able to support mental health on an individual level? What are we doing on an interpersonal level? How are we bolstering those connections amongst family members, amongst friends, amongst different social networks to improve the mental health of our youth? What's happening on an organizational level, right? For so different community organizations, what's being done on a school level to support the mental health of their students, right? Or youth that they may work with within their organizations. What's happening on a community level? How are those organizations and schools really working together to support and promote the mental health for our youth here in Hawaii? And then ultimately, what's happening on a societal level, right? And that kind of broad aspect. What kind of policies are in place, keeping in mind culture and how that impacts mental health and our view on mental health? What are those social norms, right, that influence our decisions and how we think about different things? So all of our prevention efforts needs to be happening on multiple levels. So a lot of moving pieces, but it really takes partnerships, right? Which is what Mental Health America of Hawaii really tries to do, is partner with community members and community organizations to really raise awareness and try to spread those information and resources out there and available as far and as wide as we can. Right, so let's talk about the first kind of solution that we have in a general way, is to talk about it, right? It's okay to talk about mental health, right? It's actually important that we are having these conversations about mental health, that we're creating the safe spaces necessary to be able to have those dialogues, right? But it's also just as important that we're being mindful about how we are talking about mental health too, right? So the example I'll highlight for us today is using person first language, but we've also already kind of touched upon the media portrayal that we see mental health in our media today is not always in a positive light, but even on an individual level when we have those conversations. So for an example, we want to use person first language. And what I mean by that is putting the person first, right? Words are powerful, and how we are talking about mental health is especially impactful, right? We don't want to contribute to that level of stigma that's still out there, right? So we really want to try to model person first language, right? A person is not only their diagnoses, there are other parts of their identity. So what we want to be doing, instead of using terms like insane, crazy, psycho, maniac, nuts, chronic, attention seeker, whatever that may be, we are instead putting the individual first. So a person who is experiencing a mental health problem, a person living with a substance use disorder, right? A person living with bipolar disorder, that we are putting the person first, even in the words and the language that we are using. So this is not an easy thing to do. A lot of these words and phrases and these viewpoints have been around for generations. So this probably isn't something that's going to happen overnight, but we can at least start with ourselves, right? Be aware and cognizant of the words and phrases that we are choosing to use, so we don't ourselves contribute to that stigma when we are talking openly about mental health, right? Because we want to send the message to other people, and especially to our youth, that it's definitely okay to be talking about this, right? It's not a problem to have a problem, but it is a problem if it's something that we can't talk about, right? If we don't feel comfortable in opening up about. And by doing so, by talking about mental health in an open and honest way, we may also be providing appropriate language for our youth to talk about what it is that they are thinking, that they are feeling, or what they may be experiencing, because they may not even have that, right? Have the right language to express themselves and to talk about what's going on. Okay? I do see in the chat there are a lot of resources, however, not very accessible. Not a lot of people know about resources. Thank you for that comment. That's absolutely true, right? That there are so many different kinds of resources that are available. Unfortunately, not all of them may be accessible to every single person, right? In this community, we may see technological barriers. There are barriers to access, so all the kind of barriers and challenges that we were talking about, right? Prevent people from accessing those resources, right? So again, something to keep in mind, but also why it's so important that we're raising awareness, that we're making our communities aware that these resources are out there, they're available. You know, let me share information with you. Let me help you find what that help is. Okay? All right, so another solution that we have is supporting each other, right? Really focusing on those connections, and encouraging youth to support each other as well, right? Remember when we go back to that Kauai longitudinal study, one meaningful adult and one meaningful peer, right? So having youth supporting each other, encouraging our youth to check in, and even ourselves to check in with our family, with our friends, the people who we are practicing physical distancing alongside within our household or within our little bubbles, or check in with our friends or loved ones who we are practicing physical distancing with, right? And luckily enough, we do live in a world where technology is fairly available, right, to us, where we are able to connect with other people via text message, phone calls, emails, social media, video chat. But there's still also ways to connect with people outside of that technology realm, right? So that could be sending physical letters through snail mail, sending a postcard, right? Just kind of checking in physical ways as well. We want to listen actively and without judgment. That goes a long way in supporting each other. Is like just provide that space, right, to listen, right, without judgment. So, you know, listening seems like the easiest thing in the world to do, but it's actually not all the time to be able to listen actively to someone and withhold our own biases if we are even aware of what those biases are. It requires more than just kind of sitting there and letting someone talk, right? It's asking questions, right? It's validating emotions and thoughts. It's repeating back information, right? Paraphrasing, like, let me just, you know, make sure I understand what you're talking about, or asking questions like, what does that mean to you, right? Or tell me more about that, right? And it also means sometimes asking the tough questions, right? And what I mean by that is specifically when someone is experiencing a crisis, right? If someone is having suicidal thoughts or they are struggling with suicidality, that those questions are also including, are you thinking about suicide? Have you made a suicide plan? How long have you been having these thoughts? It's something that we've heard before, that we don't want to talk about suicide, or we don't want to ask these kind of really direct questions because we don't want to put ideas in people's heads, or we don't want to plant any seeds. And that's just not true. There's been tons of research that has come out over the years that shows that by asking these kinds of direct questions and by talking about suicide in a safe way, we are not planting any seeds, we are not putting any ideas in people's heads, right? In fact, what we're doing is we're asking these direct questions because if we don't ask, we don't know, right? And if we don't know, then we're not able to really support and connect that individual to the help and the resources that they need in that moment, right? So it's important that we are asking those questions, as uncomfortable as it may be. If, however, you feel unprepared in asking this kind of direct question, for someone that you're worried about, don't worry, there's even help for situations like that, right? So we'll be going over different crisis resources that are available to us 24/7. And I probably should have mentioned this in the very beginning. You're going to get a copy of all of these slides as well as those resources. So I apologize if you've been scrambling to take down notes. You will be getting access to all of these slides as well as a link to a recording to this training after today. Okay? And we want to encourage help-seeking behaviors as well. We want to let people know that there is help available out there. There are people who care, and getting help is effective. It does work. Right, so there's a lot of really great campaigns that are out there to help raise awareness about mental health and encourage help-seeking behaviors. This is one of them called Seize the Awkward by the JED Foundation and the American Foundation for Suicide Prevention. Unfortunately for today, I don't think we have time to really show this video. I'll make this link available to you, but I also encourage you to look it up. We have the website up top there. And this is just one short example of a public awareness campaign when it comes to mental health. It's just how to start that conversation, right? How do you even broach the topic when we're talking about mental health, and how can youth approach that topic with each other? All right, so what we also have as a solution is to be involved, right? So educate ourselves. Every single one of you who is on this webinar with us is already doing this, being involved, raising your own awareness, educating yourselves, right? Increasing our noticing skills, being aware of the barriers and the challenges that are present in our communities when it comes to accessing resources and services, being aware of different signs and symptoms, right? How are those presented in youth versus young adults versus adults, right? And spreading that information around, increasing awareness, and really bolstering that sense of community as well. There's still a lot of really great community events that are happening, whether it's in a virtual format or whether they're happening kind of in person, following safety guidelines. There are still things that are happening in our community that's going to bring us together, right? And that's ultimately what we really want to be bolstering and focusing on, because everything that's happening in the world today is affecting every single one of us in different ways. But one commonality that we have is that we're all kind of going through this together, right? So if we can hold on to that, if we can support each other, if we can be involved and really come together as a community and help as best we can, right, in the best ways that we can, or however we can, whatever small gesture that may be, that's going to help increase our own resiliency, right? And encourage youth to be involved as well. Get involved in those community events, get involved with each other, raise awareness about mental health, right? Because that's also going to increase emotional strength and resiliency as well. And then follow us, right? I'm sure you hopefully already are. We're on social media. Sign up for our newsletter, check our websites. If you're looking for information on advocacy efforts and training efforts, we're happy to give that type of information for you as well. All right, so the last kind of solution that we have is take care of yourself, right? This is hard work, so I just want to thank you for doing it. Right? Even if you're not, professionally or personally kind of an advocate for mental health, or professionally you're kind of in that mental health field or setting, regardless, learning about mental health, raising awareness, being present and engaged is hard work, right? So thank you for doing it. Thank you for showing up and wanting to learn more about how we can support our youth, right? I want to remind you that self-care is not selfish by any means. We need to be able to take care of ourselves so we can help take care of other people. We need to be able to teach our youth that as well, that self-care and taking care of yourself and prioritizing mental health is essential, right? It's important. It's how we increase our emotional strength. It's how we add tools to our emotional toolboxes and increase our resiliency so we're better able to take on all of those things that life is throwing at us, which seems to be a lot these days. So absolutely prioritize your self-care time and encourage youth to prioritize their self-care time as well. Even if that's only 5 minutes out of your day, a couple times a day, if you could just find that time and those activities and identify different coping skills to use in different situations. And when you're feeling different emotions or even mixed emotions, that's going to help us, right? That's how we take care of our mental health. And the more we do that, the better off we are in taking care of other people. And this is especially important in times like these, when our bodies and our minds are kind of working overtime to really adjust to everything that's happening in the world, to adjust to those increasing levels of feelings of anxiety and depression. Right, so promote that self-care. It is important, especially so for our youth. We do have youth-related trainings or youth-specific trainings that are related to self-care. So if that's something that you're interested in bringing into your schools, to your students, or to your organizational programs that work and interact with youth, we do offer those in a virtual format where we really talk about self-care, why that's important, what does it look like, what does it sound like, what does it feel like, identifying those things that work for you. So as promised, here are some of the different resources that are available locally and nationally. We have the Hawaii Cares line. So this is available 24/7. It's formerly the crisis line of Hawaii. So the Hawaii Cares line is the state's kind of multiple entry point and coordinating center for behavioral health services. So they still absolutely offer crisis intervention services 24/7. So if anyone is having thoughts about suicide, or having a mental health related crisis, or please absolutely call these numbers. Oahu is 832-3100. Neighbor Islands is 1-800-753-6879. And we also have the National Suicide Prevention Lifeline as well, again available 24/7. But the Hawaii Cares line has also expanded their services to include substance use disorders, mental health services, in addition to those crisis intervention services. So if you're looking for those specific services and accessing them, feel free to call the Hawaii Cares line. They'll be able to provide that information with you as well. If you or a youth doesn't like talking on the phone, right, or making phone calls, there's also a crisis text line. You can send a text to 741-741 and someone will always text you back wanting to help, right? So it is a national line. However, if you text Aloha to 741-741, it kind of gives a clue to the person on the other side that this person may be coming from Hawaii. So they'll be able to already be thinking of connecting them to the help and resources that individual needs in their area. We also have the Trevor Helpline, which is a national hotline available 24/7 for our LGBTQ plus youth. So if you have a youth in your life, personally or professionally, who may be struggling, this is a really great resource. It's from the Trevor Project. So they have the Trevor Helpline, they have a Trevor chat. You can connect online with different communities as well. So a lot of support that's there, but the Trevor Helpline is available 24/7 for lesbian, gay, bisexual, and transgender youth, as well as a vast amount of identities that are also out there. Right. So Mental Health America of Hawaii had previously created a suicide prevention app called Kokua Life. It is free to download, I think still right now for iPhones, still again working on that update for Google stores. So Android might be on hold still for now, but there are tons of really great apps that are out there that have been created to help boost emotional strength, that provide different information and resources that are free to download. One of them is COVID Coach. So this is an app that was created for everyone to really support self-care and just really overall mental health during a pandemic. So it provides education about coping. It provides tools for self-care and to improve emotional well-being. There's ways for you to track your mood and measure your growth towards personal goals, right? It even provides graphs to help you visualize that progress. And that's just one example of an app that's out there. There's a lot of free YouTube videos that you can look up, even videos on TikTok that'll help guide you through different self-care tools, different breathing exercises, different coping skills, and really teach that, right? So a lot of different formats that we can get these resources across social media or other technology or things over the internet. Another tool that we have available to us is these screenings that I mentioned in the beginning of this presentation. One of the quickest and easiest ways to tell if you may be experiencing a mental health condition is to take a free online screen, right? So Mental Health America has 9 different screening tools for mental health conditions on our website, including youth tests. So youth are able to hop on and take that screening themselves, but we also see a variety of other tests as well. Now, I do want to note that while these screenings are not meant for us to diagnose ourselves in any way or to diagnose other people, rather what I want you to look at these online screening tools as is a good starting point in finding out more information, or maybe we can take those results that we get at the end to our doctor or to a mental health professional. And so again, we are on social media. Please feel free to reach out. Hey, we have, we're on Facebook. We run a couple different groups on Facebook as well. We have a Keiki group, our Busy Bees. We like to post activities and videos for our children. We have a book club. If reading is something that you're into, we post book recommendations for anything related to self-care, mindfulness, mental health. We also have a group for Maui, right? So if you're located in Maui and want to connect on Facebook, please join that group. We're on Instagram at Live Now is our Instagram page where we like to give tips and tools and provide ideas when it comes to specifically to healthcare. But please feel free to reach out. You have my personal contact here on the screen there. Call our offices. We're always happy to point people in the right direction, provide any kind of information or resources that you might need. We have a couple minutes left. I'll open it up now to any questions that people might have. I have seen a couple comments come into the chat box, so give me just a second. I'm going to read through them really quickly just to make sure I haven't missed anything. Let's see. Okay. So see those comments still about accessing services, talking about listening thoroughly, repeating it back, validating feelings with the parts that are true. Absolutely. Okay. Some people just need to be heard, right? They don't need a hero, just an ear. I love that comment. Absolutely. Sometimes it just takes someone to listen, right? And to be there and to be present. And listening takes practice, right? Sometimes, we cannot force anyone to open up if they are not ready to. Sometimes we may get some pushback. We just have to meet that person where they're at, unless, however, they are in a crisis situation and we need to intervene immediately to get them that help. We just need to meet that person where they're at. So if you do get some pushback, if the other person starts getting upset in any way by talking about it, just take a step back, right? And maybe try again at another time, or just come from that place of caring, right? I'm asking and I want to talk about this because I care about you. We play a lot of different roles, right, in youth's life. There's a lot of roles that have to do with support networks. I'm kind of paraphrasing and summarizing. There's a lot of really great comments and discussions that are happening in the chat box as well. I do love that comment. Think of it as airplane safety rules. So when we're talking about self-care, that we need to take care of ourselves before we can take care of other people, putting your mask on first and then assist your child, because otherwise you are no good to them. You might not be as helpful, right? Absolutely. Thank you, Dr. G and Jerry, for helping me out, dropping that information in there. All right, so what can I do if my boyfriend doesn't want to accept that he is bipolar? So that's a great question. Again, it kind of goes back to kind of meeting that person where they're at. So unless he's in immediate danger of hurting himself or other people, I mean, there's only so much that we can do, because ultimately we can't force anyone to get help if they don't want to or they are not ready to. But what we can do is let that individual know that we are there for them, that we're here for them, that we can help them find help and resources that's available. So when you are ready or you want to find out more information, let's do that. Maybe we can leave pieces of information and resources with them, right? If you feel like you are ready to take that next step or want to look into getting help, please hold on to this, right? Hold on to this pamphlet or hold on to this link, take note of it, because those resources are out there. I see in the Q&A box, do you have a provider directory? If so, how does one get on that list? Great questions, both of those, right? So we do have a Finding Help Services directory, which you can find on our website and download it in PDF format. So I mentioned before that we don't necessarily provide direct services, so we don't recommend specific providers. There are different ways that you can connect with different providers or look at provider directories. But if you want to get your organization or any other kind of resources on our Finding Help Services phone list, reach out to us. You can email me or email info@mentalhealthhawaii.org, and we can add that to our list for people to access, right? So reach out to us. We're happy to make those connections and spread that information there. Let's see. Okay, so that's all the questions that I'm seeing so far. However, if the questions come up at a later time today, next week, next month, whatever that may be, again, please feel free to reach out. We at Mental Health America of Hawaii really make an effort to make ourselves accessible and available to answer any questions, provide any information, point people in the right direction. It is top of the hour, and so if there are no other questions, I do see a couple comments still kind of trickling in the chat box. I just want to say thank you for showing up today, for being present, being engaged, for asking questions, for putting those comments and really awesome like little nuggets of information and advice and guidance in the chat box. You all already have a lot of information already. Thank you for wanting to learn more about how we can best support our youth here in Hawaii, especially in the world that we're living in today. So enjoy the rest of your day. Practice that self-care, get it in. It was a holiday yesterday, so some of us this is our Monday starting off our week, but practice that self-care, get it in, take care of your mental health, prioritize it, and have a great rest of your day. Have a great rest of your week, and thank you so much for joining us.